Earlier, we reported on how actress Angelina Jolie just received a double mastectomy to prevent her from getting breast cancer. A breast cancer diagnosis is a frightening prospect, and in a KTVU investigation, we discovered women may be scared into getting more aggressive treatment than they need. In a story you will see only on 2, our health and science editor John Fowler uncovered what your doctor may not be telling you.
Susan Fisher of Danville told me she had a tiny lump, low-risk breast cancer 2 years ago. Since then, a double mastectomy, reconstructive surgeries, and now a bag full of medicine, overkill, she calls it, from the big business of breast cancer.
There was no benefit to any treatment beyond a lumpectomy.
Fisher said 3 doctors from 3 major Bay Area medical centers pressured her to have chemo and 10 years of hormone therapy by showing her this physicians-only individual risk analysis program called Adjuvant Online.
It's a model that predicts recurrence, predicts death from breast cancer.
Dr. Michael Sherman was one of Fisher's oncologists. He says he trusts Adjuvant Online but lets patients decide. In Fisher's case, it showed an 18% risk of death in 10 years, the red bar, but drops it to 8%, the bottom yellow, predicting a 10% benefit from chemo and hormone therapy.
That allows us to then dictate for any individual what the cost would be in terms of the treatment versus their absolute benefit.
There are other cancer risk calculators. We asked Fisher to try this newer online predictor developed through Harvard Medical School. It's called Cancer Math. It is open source, free, and available to anyone. The same patient data input yields very different results. Cancer Math shows Fisher's 10-year risk of death much lower, just 6%, with treatment 4%, a 2% benefit, and 1% is the margin of error.
My risk was exactly the same whether I took the drugs or I didn't.
We discovered Adjuvant Online got funding from cancer drug makers, and for most women it significantly overestimates risk of death and effectiveness of therapy. That's according to peer-reviewed research by Harvard Medical School professor and Cancer Math creator James Michelson. He told me he rechecked Adjuvant Online just last week and it's simply outdated.
It has probably been superseded, and hopefully our work will also be superseded by another generation.
Overestimating death risk could unnecessarily scare patients.
They're so concerned about dying of breast cancer that many women will say, I want the most aggressive treatment.
Susan Fisher told me she didn't feel comfortable with chemo or hormone therapy.
I don't think so. I don't think I want this. I'd rather take my chances.
And the cancer predictor she trusts shows her chances are good. Health and Science Editor John Fowler, KTVU, Channel 2 News.